We know Governor Lee's order earlier this week, all non-essential surgeries canceled throughout the state of Tennessee through April 13th. It got us talking in the newsroom about different types of treatment you might need. Here's a question. What do you do if you suffer a strain or a sprain or, heaven forbid, a broken leg? Well, Tennessee Orthopedic Clinics is using telemedicine to help patients out. And join me now via FaceTime is Dr. Tracy Pesut. Doctor, thank you for being with us.
Thank you for having me.
So first of all, say I have a sprain. What would be the process to diagnose that and treat it through telemedicine?
So where we start off is you call the office to make an appointment like you normally would. And what we do is set it up through the normal timing, and we'll have our office staff set up the information to help you set up an app on your phone, your computer, so that we can access you similarly to like a FaceTime or a Skype, so that we can see you and you can see us.
You've had some patients calling in through this method already. What are some of their maladies that they're suffering right now? How are you able to help them?
So a lot of what we're seeing right now is, because it's relatively new, is rechecks and post-op. So it provides those patients that were already established in the practice to follow up without having to come into the actual site. For new patients and new complaints, we're working on setting up X-ray availability, because it's difficult to look at and diagnose any type of fracture without X-ray evaluation. So some of the things we're looking at and establishing are X-ray appointments, so the patients can come in a more convenient, safer interaction, and we'll set up the appointment to evaluate them face-to-face utilizing the telemedicine app.
And you're very hands-on, obviously. Full disclosure, I've been a patient of yours for a while. Broken foot, broken ankle, all kinds of stuff. This has got to be challenging for you. How are you adapting?
So it is pretty tough. Luckily, we can see the patient, so I think it has a little bit more of a personal touch than just a phone call. But I obviously, trying to diagnose patients, you want to establish a rapport with them, and so I kind of start the appointment with just seeing how they're doing. It's kind of a scary time, just kind of touching base with how they're coping with the changes, and then going into the actual appointment and what they've called in for.
I know a lot of people have been asking us, is telemedicine covered by insurance?
So with the recent changes, Medicare and Medicaid have approved for a temporary period of time that they will cover telemedicine. Hopefully going forward, they may continue if they see that it's an effective means of us seeing patients. I think it provides a lot of convenience for people that either can't get out for some reason, have difficulty with transportation after an injury, or at business, they can't get away from work. So it can provide another means of just providing care.
Well, we thank you guys for all you're doing. Tracy Pesut, the doctor there at Tennessee Orthopedic Clinic, we appreciate it. Good luck to you in the days ahead, and thanks for kind of working around this challenging time.
Thank you.
All right, good info there on telemedicine. It's becoming even more popular because of, well, the crisis that we're going through right now. For more information on how to navigate healthcare during the pandemic and on telemedicine through Tennessee Orthopedic Clinics, you can go to our website, WATE.com.